I'm Chinelo Vincent from Nigeria. My topic for the discussion or presentation is inpatient satisfaction with food served in Imo State University Teaching Hospital, Orlu, in Nigeria. As introduction, the daily intake of adequate food rich in all classes of nutrients help in promoting wound healing, decrease the occurrence of complications, as well as aid the patient's recovery from diseases or injuries. So every client has the fundamental right to receive a qualitative care that upholds the client's individual beliefs, self-esteem, culture, religion, values, and preferences. Food services like other care rendered in hospital is supposed to provide clients optimal satisfaction, as no aspect of healthcare is insignificant, but rather work together to provide patients recovery. So adequate food services enhance the overall rating of the quality of hospital service. Food service managers who desire to improve their patient satisfaction should focus their attention on meeting or exceeding patients' expectations for food quality. As an adage says, you are what you eat. So daily consumption of a healthy diet builds up immunity, promotes healthy living, and also quick recovery from illness. So what do we mean by adequate nutrition? We say that adequate nutrition is that which contains all the food nutrients in the right proportion and combination. So every stage of life needs adequate nutrition for growth and development. So, and the food we eat are grouped into several classes. We have carbohydrates, proteins, fats, oils, water, vitamins, and minerals. The healthcare provider has a mandatory role to ensure that these nutrients are adequately provided in clients' meal until they become independent, when the nurse teaches them how to maintain a healthy living through what they eat. There are a lot of factors that actually affect food satisfaction. Some of them are food temperature, the appearance of food, the taste of food, even the quality and quantity of food, and the environment where this food are served. They are part of that. And some of these factors, even the culture, can be part of factors that promote satisfaction. Then, and this satisfaction can be improved through explaining the importance of meal options to patients, because we notice that some patients don't like the kind of food they are given. Maybe someone that is diabetic, the person likes eating carbohydrates, so most of them don't like it. So as a healthcare personnel, we are required to explain the importance of that particular meal option given to that patient, and make sure that these meals are delivered on time in adequate temperature. So the method, I use a descriptive study to determine inpatient satisfaction with food served in the wards of this hospital. I have a total of 154 patients that are enrolled in the study, and the method of my collection was the questionnaire. After distributing the questionnaire to 154 clients, 150 were correctly filled and some were collected to analyze the data. So in my analysis of data, for the first question, it was asked that what is the level of satisfaction of food served in wards of this hospital. So from the patient's rating, when the questionnaire were given, the patient said that just only 5.3% said that they were very satisfied. 3.3% said that they are moderately satisfied, and 44.7% were satisfied. 46.7% also were very dissatisfied. That is very, very poor. So in my second question, and I asked what actually are responsible for this dissatisfaction of food that they were served. And some of the factors these clients rated that 29.3% said that the food were not served at an appropriate time. Maybe they're supposed to eat by 2 p.m. and the food were served by 4 p.m. So some of them also, 45.3%, said that the appearance of the food was not appetizing, because you look at the food before you start eating the food. The food has to be appetizing for you to even try to eat it. 33.7% said that the food were served cold, and 24.7% said that the staff were not friendly. They just give them food as if they were quarreling or whatever. So 5.3% said that food was served in a dirty environment, and 40.7% said that they were using any plate to serve the food. The third question says, what are the patient's suggestions on ways of improving their satisfaction, since most of them were not satisfied with the food? And this said that 46.7% said that food should be served at appropriate time, because these questions were asked that all of them should now read the question. It was multiple responses, so that they can now read, what can improve their satisfaction. 49.3% said that food should be well presented. 46.7% said that serving food with good plates and spoons will make them satisfied. Then also 47.3% said that meals should be introduced, so that you need to tell the patient that the food are coming so time, this and that, so that they will get prepared to eat the food. Then a major percentage, 63.3%, said that food should be served when it is still warm or hot, that they cannot eat a cold food. And 37.3% said that environments where foods are served should be made neat. Then in my results and discussion, from the first question, which said, the level of satisfaction of the food, it was recorded that only 5.3% were highly satisfied, and 3.3% have moderate satisfaction. A major percentage of 44.7% had a fair level of satisfaction, and 46.7% were poorly satisfied. And this, of course, corresponds with the finding at Asaba, that is a Federal Medical Center Asaba, which has a close range with the hospital where I used, just to show that the problem is with the environment, that 8% of the patients had high satisfaction, to be compared with what I saw in the hospital I used. So which shows that adequate food services should actually be maintained, and the environment needs to be checked for these patients to have adequate meal, because we know that wound healing depends on the kind of food you eat. Then in the second question also, we are looking at the factors that cause their dissatisfaction. And of course, the patients revealed that 4.5% said that the appearance of food caused their dissatisfaction. And also 40.7% opened that they receive food in an unattractive plates and dishes. Maybe some plates are broken, or you have rubber plates to serve the meal with them, so they will not like to eat it. So also, they said that 24.7% also said that that the food, they complain of unfriendly attitude of these food servers, especially the health personnel. So they just come and keep the food on their table and leave. So they are not satisfied with that. Then the question number 3 now said, what the ways to actually improve this satisfaction, at least the ways that this patient can say to improve their satisfaction since they are dissatisfied. And it shows that 63.3% indicated that they will be satisfied when the foods were served warm or hot. And also 57.3% said that food should be served in an attractive way to help them eat that meal. Then 47.3% suggested for introduction of meal options. They said that you should provide meal options so that they can now choose from whatever the meal, what they want to eat. But in our hospital, what they do is that they just bring food to the patient. The patient may not even like to eat that food. Nobody cares. And that is why they keep on living in, staying in the hospital for longer days before they could be discharged. So this also, that 8.7% also think that fruits after meal, they suggest to give them fruits after meal. Nobody is serving such in hospitals. And 37.3% suggested that the food should be served in a clean environment. And from all these suggestions denoted, that is the way to improve their satisfaction is corresponds with what Anita 2013 said, that provision of food and drinks for patients remain a largely unemployed phenomenon. However, bridging the gap that existed between perception and expectation can improve the quality of meal services for the purpose of maximizing patients' satisfaction. So in conclusion, the study actually revealed that an alarming rate of 91.4% we are not satisfied with the food that we are served in the hospital. Most of them complained that the presentation of the meal was very poor and the food was served late, and the unfriendly manner of the food servers. Then also there are things that actually affect their satisfaction, the appearance of the food, serving foods with unattractive plates, then the unfriendliness of food servers. And patients suggested that food should be served hot, and meal options should be introduced so that they can choose from the options, and food should be presented to improve their appetite. So these identified parts of food services in Imo State University Teaching Hospital, Orlu in Nigeria, are very important to improve patient satisfaction with meals served, as well as the healthcare delivery system. So this shows that all hands must be on deck, especially the health personnel in Nigeria, to make sure that patients actually eat their food well. And eating their food depends on the ways to actually improve their satisfaction. Since an alarming rate of more than 90%, we are satisfied with the foods that we are served in the hospital. Thank you so much. And thank you for listening. God bless you all.